With me is the Afghan Health Minister. He's here in Delhi for a key meeting, a key conference. But we know that India is playing an important role when it comes to engaging with the Afghan healthcare domain, the sector, and of course providing a lot of support in terms of vaccines, in terms of medicines. Sir, welcome to Wion and welcome to Delhi. And my first question to you is, how do you see India-Afghanistan relationship?
نحمده ونصلي على رسوله الكريم بسم الله الرحمن الرحيم.
First of all, I would like to convey my regards to viewers and listeners of Wion. I've traveled to India for health issues, health discussions. Afghanistan values its long-standing and constructive relationship with India. Our engagement with India has traditionally been people-centric, particularly in health, education, and humanitarian assistance. We see India as an important regional partner, and our current interaction reflects a mutual interest in pragmatic cooperation based on respect, humanitarian consideration, and shared responsibility.
So here in Delhi, you met with the Indian Health Minister. India has promised more support to the Afghan side. So what was your meeting like, and essentially how do you see the support that was given or announced by the Indian Health Minister JP Nadda?
Okay, first of all, I would like to state that this was my first visit to India. Since the establishment of the Islamic Emirates of Afghanistan, I was the first health minister to travel to India. The discussions with His Excellency, the Minister of Health and Family Welfare, were focused on strengthening cooperation and health infrastructure, medical equipment support, regulatory coordination, and capacity building. Both sides explored collaboration in hospital development, medical supply, pharmaceutical regulation, and training of health professionals in India. Additionally, I've received promises on supply of oncological and cancer treatment medicines, which will be supplied on an immediate basis.
So let's talk about the medical visas. Many Afghans regularly come to India for treatment. How much there was a conversation on that? What's your expectation from the Indian side? And perhaps if you can talk about how many Afghans benefited by coming to India when it comes to using Indian healthcare systems.
Afghans has been traveling to India for medical treatment since a long time. Medical visas have been a vital humanitarian channel. We have recently seen around 500 visas being issued to Afghan nationals seeking medical treatment in India. While exact figures vary, thousands of Afghan patients have benefited from this channel in recent years.
Continuing with my previous question, when it comes to India's announcement on new infrastructure, when it comes to the healthcare, India has announced a new thalassemia center. India has announced its support to the hospital already existing in Kabul. In fact, my data suggests that as to how India plans to establish a trauma center in Kabul, 5 maternity health clinics in Afghanistan, and also the replacement of the heating system at the Indira Gandhi Institute of Child Health in Kabul. So how do you see so many announcements being made by India when it comes to building up the Afghan healthcare infrastructure?
Indira Gandhi Hospital is one of the major pediatric care hospital in Afghanistan. We have previously requested Honorable Indian Charge d'Affaires to Afghanistan regarding strengthening the infrastructure and the Indira Gandhi Pediatric Hospital. We have received promise of CT scan machine and infrastructure strengthening support to Indira Gandhi Pediatric Hospital. When it comes to overall infrastructure cooperation with India, Afghanistan would prioritize tertiary healthcare projects, including specialized hospitals, diagnostic centers, cancer treatment facilities, and mother and child healthcare services with India.
یعنی خاک سلام خودل شو.
Correct. Continuing on that aspect, training has been another element when it comes to India-Afghanistan relationship. Are there any plans for training of Afghan doctors or people working in the healthcare system? And also, India planning to send any team as well to do these trainings? And one thing that has stood out is the Jaipur foot, which has been used by many Afghans. Your country has been impacted by decades of war, and this Jaipur foot has been a symbol of how India has been supporting your country. So if perhaps you can talk about that.
افغانستان تاسو ته بهتر معلومه ده چې
So Afghanistan have been suffering in war and instability since 45 years. We have previously received support from medical support from India. The capacity building remains a top priority for Afghanistan, including training Afghan doctors in India and travel of the Indian doctor delegation to Afghanistan to establish medical support camps and joint working groups.
هلته خدمت روان دی.
So we've seen cooperation in sectors, as you have talked about, India helping in the infrastructure, India helping in training. But any plans in traditional medicines like Ayurveda or Unani system? Now, India is well known globally for Ayurveda systems. Do you plan to adopt that or integrate that with the Afghan healthcare system? In fact, you were here in Delhi for the WTO meet on traditional medicine. So if you can perhaps talk about the Ayurveda system perhaps being used in your healthcare system.
ما مخکې د هندوستان د صحت په بخش کې په افغانستان کې ډېرې پروژې دي.
India has been engaged in multiple projects in Afghanistan. Some of these projects were incomplete projects from the past that India vows to complete them. When it comes to our cooperation with India and traditional medicine and Ayurveda, the cooperation with India can support research, regulation, safe integration of traditional medicine into our modern healthcare system. The meeting with Indian counterpart, the Minister of Ayush, was very fruitful. We have received a lot of commitments from them. Some of them were like establishing an traditional medicine institute and research center in Afghanistan, also providing us technical support and the Indian curriculum to be replicated in our curriculum under the Ministry of Public Health.
د هندوستان د آیوش وزارت
So now moving forward from the India bit to Afghanistan, you're focusing a lot on diversification when it comes to your healthcare system. You're looking at other countries. You've engaged a lot with India, coming at a time when you're reducing your dependency on Pakistan. We know the rules that have come when it comes to import from Pakistan, when it comes to medicines from that country. So if you can give a larger picture as to how you're looking at diversification when it comes to your healthcare system, when it comes to the import of medicines from across the world.
افغانستان یو د هغه هیوادونه نه دی چې
As you might be aware, Afghanistan is a landlocked country. Our pharma market was controlled by 6 or 7 countries where Pakistan had a major market share. Due to recent deterioration of relationship, we were struggling with pharmaceutical supply to our market. India has helped to ensure continuity of essential supplies, alternative routes solution, and it has helped us to reduce dependency on a single corridor. During our visit to India, we have managed to meet several pharmaceutical production companies to work with them, filling the gap of pharmaceuticals in Afghanistan market.
Continuing with Pakistan, now how do you plan to de-link yourself when it comes to Pakistan, when it comes to the healthcare sector? We have seen the broader trend in Afghanistan is to de-link from Pakistan, especially after the attack which happened on Kabul and the border areas as well. So we know how the relationship is going between Afghanistan and Pakistan, but to you, Health Minister Sir, my question is on the healthcare system. How do you plan to de-link your dependency from that particular market from Pakistan?
افغانستان د صحت په باب کې
As you know, Afghanistan have been through lots of hardship. However, we still do have good infrastructure in Afghanistan. We do have good doctors. But when it comes to the capacity building of our doctors, and it comes to supply of pharmaceuticals and equipment, we are trying to diversify our partnership with several countries. As we speak, my Deputy Minister for Food and Drug have traveled to another country. I've traveled here to India, so we are relying on India and other partners to fill in the gap that's there in our market.
The big worry for you remains on the fake drugs or the pharmaceutical products that do not meet the standards. On that, how big is your worry? And to resolve this problem of fake drugs, what are you doing?
It is a serious concern indeed, and NUPH is trying to strengthen regulation, inspection, and laboratory testing to tackle this problem. Additionally, my Deputy Minister have had a trip to India previously where we have spoken about mutual cooperation and tackling the fake and low-quality medicine supply to our market. Since I've taken over the stewardship of the Ministry of Public Health, we have given this issue a serious attention, and we have established a comprehensive structure within our Food and Drug Authority to tackle this problem.
So, women's health care, as the Afghan health minister, what's your take? Because women's health care is an important element of the society. Maternity health is an important element of society. There are reports of restrictions as well on women healthcare workers. So if you can perhaps talk on that.
Afghan millat
when it comes to women's reach to the health services, I would state that Afghan nation is made of both women and men. Women also fall sick and they need health service. In Afghanistan's health sector, we have recruited a huge number of female health workers, starting right from midwives to specialist doctors. We are working on expanding the health coverage or outreach to both women and children in remote areas of Afghanistan. We are also trying to adjust health services according to our need, necessity, Afghan culture, and Islamic principles.
Well, thank you so much, sir, for speaking to Wion, giving us a broader picture about the India-Afghanistan healthcare system and how both countries are engaging, and the Indian support to your country. And I know that you understand हिंदी as well, तो मैं हिंदी में भी यही बोलना चाहूँगा आपसे कि उम्मीद करते हैं भारत और अफगानिस्तान के जो रिश्ते हैं आने वाले दिनों में और अच्छे हों.
फिलहाल दोबारा जुकम सफर हो.
My recent visit to India, as I mentioned earlier, was the first visit of the Health Minister of the Islamic Emirate of Afghanistan. I'm here to replicate the problems of my nation, and our relationship with India have resulted in outcomes beyond our expectations. I'm looking forward to expand this partnership because the relationship between India and Afghanistan is deep-rooted and people-centric, and it's based on humanitarian factors. I'm looking forward to expand on this cooperation when it comes to pharmaceutical supplies, to capacity building, and hospital infrastructure.
Thank you, sir. Shukriya, sir. यही बोल सकता हूँ मैं. Thank you, sir.
I would like to thank you also for echoing our voice to the Indian nation.
Thank you, sir.